Okay, so hi everyone, this is Dr. Shaan from Vitality Chiropractic. Welcome back to our interview series where I'll be talking with other healthcare practitioners about their stories, how they got started, and of course the people that they help. Today's guest is Dr. Latiff. He's the owner of Coast Dental. He's a fellow of the prestigious Royal Australian College of Dental Surgeons and is an alumni member of the Las Vegas Institute of Advanced Dental Studies. He obtained his BDS from the National University of Singapore in 2007 and has served in various government institutions such as the National Dental Centre, Health Promotion Board, Singapore Armed Forces, and Singhealth Polyclinics before moving into private practice in 2009. He now works with a range of ages, helping children improve their alignment and jaw problems from a young age without the need for surgery. Hey, Dr. Latiff, how's it going today? Thank you for joining me.
Thank you for having me, Shaan. It's a pleasure to be here. Thank you for organizing this.
Oh, no, absolutely. It's a pleasure to have you. So let me start. I'm sure most people have been to a dentist, but maybe not everyone understands exactly what the role of a dentist is. How would you describe dentistry to the layperson?
Yeah, well, the realm of dentistry has changed tremendously in the past 10, 20 years. From what it used to be, you only go to see a dentist when you're in pain, to a lot right now is a lot more prevention of diseases. We're looking at prevention of high blood pressure, diabetes, a lot of these chronic problems that we're seeing in the rest of the body. A lot of it has got links to the mouth, and we've known that for several years now. So there's a lot more of prevention that we're doing, and also a lot more of aesthetics that we're getting into as well, in terms of people want to look good. A lot of them are, in some of my clients who are in business, they're meeting people, they're on social media, they're giving talks and presentations. So some of them who have got self-esteem issues because they're either shy about their teeth, they're self-conscious, they've always been teased about their teeth, or they're having low self-esteem because of the way they look. Aesthetic dentistry can play a big part in helping them. And lately we're looking more into sleep as well, sleep dentistry, where we're looking at helping people to sleep better. And this has got to do with their airways, their jaw structure, and of course, the muscles of the face as well. So we look at different aspects all the way from prevention of dental problems to the rest of the body, as well as cosmetics, as well as sleep and wellness.
Well, that sounds like a very holistic approach. I mean, I agree. When I was a kid and I would talk to my mom about going to the dentist, she'd have these horrifying dreams and images of, people pulling their teeth out when she was a kid. And then I went to university and they started talking about things like endocarditis and how it affects. So it seems like also including sleep is a much more holistic approach. But if we go back to the beginning, so for yourself, why did you choose to become a dentist?
Well, to be honest, I've always been interested in medicine. From a very young age, I always wanted to do medicine. So I applied for medicine. I got medicine in the UK, in King's College. I also got a place to study dentistry in Singapore. So I chose to study dentistry because I didn't want to be away from family at that point of time. And cost-wise, it was also a lot more. It was a lot more costly to go abroad to study in the UK. So at that point, I just wanted to just give it a try, give it a shot. And I tried dentistry for 2 years. Absolutely didn't like it the first 2 years. But once I started to see patients, it's more hands-on. So once you start actually getting to do things with your hands, I loved it, and no regrets ever since.
It's funny, actually. I have a friend who he started doing dentistry at King's as well, and he said he hated the first 2 years because it's cranial nerves. So he's learning. He's like, I haven't looked at any patients, I haven't looked at any conditions. It's just been, all this other anatomy and physiology.
Yes.
Okay, and I understand you're also working on some other further studies at the moment.
Yes, I mean, in terms of dentistry, it's always ever evolving. So there's always new materials that's being developed, new techniques, new advances in surgery. That's in terms of the dental aspect. But I'm also doing a master's program in psychology and neuroscience because I see a lot of links with the body and the mind. And what we're doing is that we are developing some programs to deal with children who suffer from ADHD or autism, and we're trying to link up some of these programs together with our program that we're running, which has got to do with a lot to do with sleep and the improvement of sleep. And we see that there's lots of links with this, with some neurodevelopmental disorders as well.
Okay, so out of curiosity then, for say, whether it's, an adult or a child and they're coming in and they're having kind of sleep issues, what would your approach be for that particular patient?
Well, some of them, they have sleep issues. A lot of times it's got to do with the breathing and the airway. So if their jaws are constricted, if they have a small dental arch, what happens is that the tongue is forced to be displaced more posteriorly. So the tongue kind of blocks the airway. So a lot of the treatments that we do go into widening the jaw structures, and also to change the posture of the tongue, because the tongue is a muscular organ and you can train the tongue with some specific exercises to change the muscle tone of the tongue. And in that, and of course we introduce some breathing exercises as well. We make some small changes in their sleeping posture, and I think this goes a long way to improve their quality of sleep. And if this doesn't work, there's always an option of surgery where they see an ENT surgeon as well. So we work with some ENT surgeons as well. But for all of this, surgery is always something that we always want to try to avoid surgery as much as we can. So we always would want to try something which is very least invasive, minimal invasive, before we actually look at some options of surgery.
And I know, of course, when we first met, we were talking a lot more about effects of the TMJ and TMD. Could you tell people more about the dental approach and the approach you have that, of course, is, as you mentioned, less based on surgery?
Sorry, I didn't get the last part, Shaan.
So you mentioned, of course, less based on surgery, but I know a lot of, say, exercise and other techniques you're using.
For in terms of TMD, yeah?
Yeah, correct.
Yeah, so again, in terms of TMD, if the jaw is positioned in the place where it puts a lot of stress on the joints, it can cause, a lot of it is a muscle-related pain. A lot of the pain that we experience, the patients who have TMD, when they experience pain, a lot of time has got to do with the muscles. So our approach would be to move the jaw to a position where it kind of physiologically relaxes the muscles. So when you bring your jaw to a position where the muscles are more relaxed, that is going to help to alleviate a lot of the pains that these TMD patients are feeling. And the way to do that, the way to change the jaw resting position is to really to change the teeth position. Because when we swallow about 2,000 times a day. And every time we swallow, our teeth actually comes into contact. So when we change the position of the teeth, we are actually changing the resting posture of the jaw as well.
It's interesting, so I'm sure every person you've ever said this to, as soon as you say that your teeth have to touch when they swallow, everyone sits there and tries to very slowly swallow without you noticing.
Yes.
Yeah. So let me ask you, what drew you more towards these other conditions, such as sleep, such as going more into TMD as well?
Sorry, could you hear that again?
What drew you more towards these other conditions, such as sleep issues and TMD and working with kids in alignment?
Right. So from a very, I think it was about 7-8 years ago, I was exposed to this institute where they spoke a lot about the TMD. We've always known, as dentists, we were always exposed to TMD, even in dental schools. But a lot of time it was just brushed away, saying that it was due to stress. A lot of times it was just brushed away, saying that it's due to stress, and that patients were just told to get a night guard, and that was it. But as we learned more about TMD, as more current research was developed, and we saw the link between sleep, and of course stress is always a part to play with it, but it's kind of interrelated. So if you're not getting good sleep, automatically your stress hormones, your cortisol levels goes up, and a patient will feel more stressed. So it's not so easy as just telling a patient to, just take it easy, relax. It's not as easy as that to just solve these TMD issues. A lot of it has got to do with the physiological aspects of getting good quality sleep. So with these more recent researchers that have opened the links between airway, sleep, breathing, and TMD, it just got a lot more interesting. And I think the whole field is developing at a very, very fast pace.
Okay, now I completely understand. Anytime a patient asks me why their muscles are tensing up, and they're not a professional athlete, it's because of an alignment issue. Your body is adapting to make up for that difference. That's why the TMD, you get pain on one side, or for patients I may see, it's on one shoulder or another as well. Apart from things like, say, TMD and, of course, sleep issues, what kind of common problems or conditions do you see in your practice?
Well, the common problems would be, tooth decay, gum problems. They want to cosmetically, they want to have whiter teeth, straighter teeth. But in fact, I think only a very few portion of patients actually come in saying that they have pain from the TMD. But a lot of times when we do the new patient consultation and we see things that are happening in their mouth, and we ask them some specific questions like, have you had problems sleeping? Have you had neck aches, shoulder aches? And then they start saying, yeah, I've always had this pain. It's always been nagging, but it's always not caused them so much of a problem. So they've kind of left it alone. They've thought it was work related or something like that. But then when we go on and we kind of link the dots together, like the reason why you're getting a lot of gum problems has got to do with a bit of alignment as well. And we put it out to them. And then they then get to decide whether they want to do more treatment or not. Because to be honest, sometimes these treatments can take a lot of time and they can also be a bit costly. So it really depends. So for some patients who they're happy to leave it alone, at least they understand that they have an alignment problem. And if they ever choose to do something about it, they can do it. Some of them leave it alone. Some of them may choose to do more treatment in terms of alignment.
Okay, I think that's the main thing. It comes down to choice. It's the patient's choice at the end of the day, yeah.
Exactly.
Okay. So for yourself, I mean, you have a busy patient list. I know you have a patient coming up soon. What would you say are one of the most important factors of your success or success within a dental practice?
I think the biggest challenge in dentistry right now is actually building a relationship and communicating with patients, because there's so many changes, so many information that we have. The last thing we want to come across is people who want to try to push treatments to patients who treatments that they don't need, because a lot of these treatments, like I said, the patients don't feel any symptoms. They don't know that they're having these issues. And so a lot of it comes to education and educating them. And sometimes the dental practice is not ideal. I mean, a lot of people come with phobias. The minute they see the dental chair and the drill, they kind of, they just want to get out of the place as quickly as possible. So in terms of educating these patients, sometimes it is a challenge. But we have ways to kind of, put them in a relaxed way so that we can educate them in the most conducive way.
And you mentioned about some of the challenges you've had there. Are there any other challenges that you maybe experienced more personally, say either by opening your own practice or even when you were working for some of the government associated bodies?
Yeah. I mean, in terms of the regulations, for the most parts, the government is very supportive of businesses. But in terms of the business, there are lots of advertising guidelines. So I understand why they have these guidelines, but it kind of makes it difficult for business owners to kind of get the message across to what they want to do, because we're not allowed to write testimonials. We're not allowed to kind of promote what we're doing in certain way. There are a lot of restrictions on that. So that kind of makes it a little bit difficult. In some other parts of the world, these regulations are a little bit less tighter. So dental practices are allowed to write testimonials, patient testimonials, display them on social media. In Singapore, that's not quite allowed. So it is a bit of a challenge. So a lot of our business is dependent on 100% referrals, 100% word of mouth. Another challenge, of course, that we are facing more nowadays is companies who try to bypass the dentist. They try to make the dentist a commodity. So there are lots of companies out there who try to use artificial intelligence or some other way to kind of bypass the expertise of the dentist. So the dentist becomes like a commodity. And I think they're bringing prices, for example, for orthodontics, they're bringing down the prices to I think more than 50%, 80%. In the long run, it's gonna kind of backfire in some way, because a lot of things, like you have whitening spas that are coming out. There are lots of aligners where you just take a scan with your teeth and they ship you the aligners. There's a dentist who's working remotely trying to see your photos. So that connection is not going to be there. And these are some challenges that we face. There may be some implications in terms of the quality of care that these patients will get. We just have to wait and see what unravels.
Yeah, I think it is a little worrying. I've never had my teeth whitened personally, but I'd imagine if I did have powerful chemical in my teeth, I'd rather the dentist is doing it, not someone that's just like a technician within the clinic, and that could be a little bit worrying. So what are some goals you have, say, either for your own practice or for your profession in general?
Some of the goals that I have in my practice would be to, of course, leverage on other dentists as well, to try to train younger dentists to work with me, so that we can reach out to a bigger clientele. That is, of course, in terms of the business aspect. Professionally, yes, I want to work with healthcare professionals outside of dentistry as well, because when we look at the human body, I mean, we can't compartmentalize the body. I mean, the human body is so detailed that it takes someone an entire lifetime just to figure out one small part of the body. So for us to study that part, it has to be compartmentalized. But the human body is not meant to be treated in that way. We have to kind of look at all the different systems together, because one system will affect the other system as well. So professionally, yes, we would like to work together with as many healthcare professionals. We're talking about chiropractors, psychologists, early childhood teachers. We're looking at speech therapists, lactation consultants, the whole works, because it takes that many people, healthcare people, to work together to holistically treat a patient well.
I agree. I mean, it's like the idea of saying, oh, if I have one meal now, it's going to make me healthy forever. It's like, no, there has to be all these other aspects to it, and there has to be different specialties to all combine together. There's no silver bullet for anything.
Exactly.
So as well, you mentioned before about, of course, some of the change you want to see in your own profession and in your own practice. In an ideal world, what kind of changes would you love to see here in Singapore or other countries in terms of healthcare systems?
Yeah, well, of course, we will always like to see healthcare costs be at an affordable rate for the general public. We want to make it affordable for everyone. So what we would like to see is the government getting more involved with grants, which they have been, but we want to see more grants available to help businesses so that we can reduce our cost to the general masses. Yeah, I guess working together more with the government would be a good way to see the future of dentistry and other healthcare providers.
Of course, given the current pandemic, we're seeing changes not just here, but in lots of other countries where they're now moving more towards, I guess, what some would call more a socialist style of healthcare. Is that something you'd want to see more of in Singapore? Because I know for myself, I mean, I grew up until I think I was maybe 16 or 18, dental was free. It was all covered in NHS. Is that something you would love to see here as well? Or would you like to see something different?
I think being covered on a whole by insurance, it can backfire as well. It can always lead to over-treatment as well, because when patients are not paying for it and there's someone else who's paying for it, and especially when dentistry, a lot of it is done in, a lot of times treatment can be done when there's no symptoms. So there can be a risk of over-treating the patient as well. And I think that when patients are paying for the treatment, there's a sense of responsibility as well. If you bought a car with your own hard-earned money, you're more likely to take better care of it than if somebody just bought you a car, a brand new car. So you'll be more likely to take care of things when you actually have to pay for it as well. But I think subsidies are a good idea. So the patients can pay for them the government can subsidize those treatments as well. I think that kind of financing would be a good way to go forward.
Okay, and again, given the current lockdown or the circuit breaker we're experiencing, what are some tips or advice you would give for people who are spending more time at home?
It's a good time to focus on personal development. It's a good time to read that book that you've always wanted to. Spend more time with family. This situation is tough. It's tough for all of us. It's tough for businesses. It's tough for everyone. We will get through it for sure. This will pass. But you want to take time to make the best of it. Make the best of this time. And I think this initiative that you have done through Zoom is a great way. I think once this lockdown period is over, I think we will see more connections through Zoom, more meetings through Zoom, because it is proving to be a very, very efficient way of communicating. So I think there will be some things that will remain even after the lockdown period, but it will only help us to become more efficient.
Okay. And what for yourself? What kind of changes have you been making or trying to make so far?
Well, for ourselves, yes, we've been reaching out with different businesses, trying to form partnerships, trying to work together, trying to improve my network with people, with other people as well, trying to connect with other people so that we can find some way of working together. And these online meetings have been very, very useful for me. So, and this time, I've been using this time to actually relook at certain things in terms of the running of the business, some of the programs that we are running. It's a good time to reflect and to see what other changes we can do moving forward.
Okay. And as well as, of course, some general advice, is there any particular dental advice you would give to people now? I know that they've just closed bubble tea shops, and that's probably very helpful. But is there any other advice that you might give for people at home?
Well, I mean, the general advice is regarding healthcare and dental care is, don't wait until you have some pain. Don't wait until you have any symptoms. Do a regular checkup of your teeth as well as your entire body, because a lot of times most of the diseases that we're facing are always chronic, and we have to pick up these signs early. We have to look at the basics of healthcare, which is the way that we breathe, the way that we eat, the way that we sleep. All of these things are essential for healthcare, and we shouldn't be too quick to just reach out for the quick fixes, looking for that wonder drug or wonder surgical procedure that will help us. That there is a part to play in that, but a lot of it is our own due diligence in looking after our own healthcare.
I have a friend who's an MD back in England, and even he would say 60 to 70% of everything that's coming into them is completely preventable, whether it's by lifestyle, whether it's not making a certain accident every so often, but things can certainly be avoided. And before we go, because I know you do have a patient coming up today, before we end, just going to get a little bit more personal. If say you could talk to yourself 5 years ago, what would you say to yourself? What kind of advice would you give?
Probably to enjoy every moment a little bit more, work a little bit less, spend more time with family. I think these are the important things in life. We always say that. I think 5 years from now, I'll probably say the same thing again. But it's always going to be a constant reminder to always prioritize the more important things in life, to treasure your health, to make the best of the time that you have right now. So I think 5 years from now, I'll probably be saying the same thing to me right now.
Okay. Well, thank you so much, Dr. Latiff, for joining me today. And thank you, everybody who's watching either live or watching on the replay. If you have any questions, of course, you can always contact us via Facebook or via WhatsApp on 84389550. I'll also make sure, of course, we have Dr. Latiff and Coast Dental's information in the comments and, of course, in the post itself. So if you have any questions, of course, you can direct them to them. Otherwise, Dr. Latiff, thank you so much for joining me today.
Thank you so much, Shaan. Thank you so much. We'll catch up soon. Take care.
See you then. Bye-bye.